Tonight, the Montgomery County Sheriff is at odds with a drug and alcohol treatment center there.
Yeah, tonight, as our Jenna Webster explains, it surrounds the number of 911 calls.
This is 911. Do you have an emergency?
From inside the Crawfordsville Police Department.
198, go ahead.
Dispatchers route first responders across Montgomery County.
54-51-1.
There's nowhere else, in this community that we respond with that type of frequency.
Sheriff Ryan Needham is concerned too many of those 911 calls come from here, the Ladoga Recovery Center, an alcohol and drug addiction treatment facility.
Missing persons, suicide attempt, unconscious, suicide attempt, assistance, seizures.
Over a 13-month period, county logs show 99 calls for service. Most are for seizures, about 1 in 7.
Whether it's their intake procedure, whether it's their policies, whether it's their employees, something needs to be fixed.
The Recovery Center opened in late October 2024, averaging 55 patients a day. A medical report sheet provided by the center shows 57 incidents between January 1st and December 17th, 2025.
In early detox from different substances, it's very common to have a seizure. And so we can do all of our due diligence on the front end, looking at their history. It just depends on the person and how heavy they've been using. When they get here, it can be a completely different story.
Brian Foster is the executive director. He says they do a full mental assessment and look at substance abuse, mental health, and criminal history before admitting someone. Nurse practitioners and clinical staff can deal with non-emergent issues. They say they've added a second transport van for non-emergent trips, too.
In the event of a spike in blood pressure or seizure activity, we need to expediently get them to a hospital where there's a high enough level of care to support them.
We don't want to be one of those providers that has sentinel events that happen in the facility because we didn't act timely or appropriately.
But the sheriff says it's just not sustainable in a rural location. Ladoga Fire is all volunteers. The chief declined an interview, but says about a quarter of their calls are to the recovery center.
For all those times that those first responders are responding to Ladoga Recovery, they're not out providing the community what they should be and could be providing.
Medic 54 arriving 12:53.
And I don't think that any of them were inappropriate, and certainly not at a number that is unreasonable for our population.
Ladoga Recovery Center says as of this week, it has a contract with the private Star Ambulance.
It's disheartening, but we are committed to making this place the best that it can be and to be what we need to for the community, whatever they need us to be. And so if it's a burden on emergency services, we're going to continue to lessen the calls as much as we can.
Sheriff Needham still questions whether it will lessen the burden for first responders. In Montgomery County, Jenna Webster, 13 News.
EMS also responds to the Ladoga Center from Crawfordsville, which is about 20 minutes away. The mayor told us they support the facility calling 911 when needed, but the distance makes it difficult for first responders.